If you did turn out to have inappropriate sinus tachycardia, then the treatment option usually that most people try first is a beta blocker. The downside of that is it can lower your blood pressure, and some people feel worse with a lower blood pressure, but most people, it does help some with the symptoms. The next options are other medications like calcium channel blockers or ivabradine, which are less commonly used. And the last option would be radiofrequency catheter ablation, and that's an actual procedure that's done to your heart. It's not a surgery. But the reason that's less commonly done is because it can eventually lead to a pacemaker, and so medications are usually tried first. Now, I will say also anecdotally, I've noticed in the clinic that more patients are having sinus tachycardia, PVCs, PACs, and POTS, symptoms like that, orthostatic hypotension after COVID. And sometimes it's a part of long COVID, and I would think a lot of it seems to be related to the inflammation from COVID. But some people's symptoms go away, within 6 months. Some people's symptoms go away within 1 to 2 years. So COVID is relatively new, and so there's not as many studies on it. But it does seem that it does eventually go away. It just takes time, and so that's something to consider as well.